Okay, so first I wash my hands. Hi, I'm McKenna. I'm going to be your nurse today. Can I have your name and date of birth, please?
Elijah Zinn, 10/19/2000.
Alright, do you have any allergies, Elijah?
No, ma'am.
Okay, shut the curtain for privacy. I'll be keeping you safe through the entire assessment today and making sure I'm explaining what I'm doing. So first I'll just ask you a few questions. Do you have diabetes?
No.
Do you have any varicose veins or any changes with them?
I don't have varicose veins.
Okay, and do you have any problems with your blood circulation?
No.
Alright, so my patient would normally be in Fowler's position. First I'll be assessing the hands and the arms. So the skin color is normal. There's no swelling, lesions, or bruising on either side. And the muscles are a normal size as well. There's no muscle atrophy or hyperatrophy. And the nails are a normal angle. There's no clubbing. And the nail beds are pink, which is normal. And it's the same on the other side. They're normal angle, no clubbing, and the elbows are pink. Both arms are symmetrical, and the size is also normal. So now I'll be assessing the skin temperature. So I'll be using the back of my hand to assess. And the skin is warm on both sides, which is normal. And the texture of the skin is dry and smooth. So, and I'll be checking the skin trigger while I'm here, which is good and normal because the skin bounces back. And now I'll be assessing the pulses. So I'll start with the brachial pulse. Okay, so this pulse is strong and normal. I'd give it a +4, and then I'll just do the radial pulse. This pulse is also strong and normal, and I'll give this one a +4 as well, and then I'll do the same thing on the other side. Okay, so this side is also normal, has good rhythm and is strong, so I'd give that a +4. And this, the radial pulse is normal, has good rhythm, and has a strength of +4 as well. So next I'll be doing the capillary refill test. So I'll just be pressing down the nail. It should blanch white and then turn back to pink once I let go, which it did, and it should do that in less than 2 or 3 seconds. To be a brisk refill, which it was. And I'll be doing this side as well. And that side is also a brisk refill. So now I'll be assessing the legs. Okay, so first I would assess the legs. It's fine. I don't know why it's not. Just move closer. Okay, so the skin color is normal on both legs. There's no edema in the ankles or the feet, and there's no lesions or bruising. Either the muscles in the legs are normal. There's no muscle atrophy or hyperatrophy, and the nails are pink and are normally angled. There's no clubbing, and it's the same on the other side. The legs are even, are symmetrical, and they're both normal size. So now I'll be assessing the skin temperature down here as well. On the other side. And the skin is warm, which is normal, and the texture of the legs is smooth and dry as well. So now I will be assessing the pulses of the legs. So the first would be the femoral artery, which is in the upper leg, so it is inferior to the inguinal ligament in the groin, and in between the superior iliac spine and the symphatic pubis. Yeah, we're just gonna go with that. But that's in the upper legs, and now I'll be doing the popliteal pulse behind the knee. Okay, so the pulse is normal. It's not as strong because it's a lot deeper. And I would give it a strength of +3, but it is a normal rhythm. And I'll do the same thing on the other side. This one also has a normal rhythm and is pretty strong, and I give it a +3. And now I'll be doing the tibial pulse, which is back here. So the tibial pulse is strong, and has a normal rhythm, so I would give it a +4. And then I'll just do the dorsalis pedal pulse as well. So this pulse is strong and has a normal rhythm. I give it a +4. So then I'll check the popliteal or the tibial and the dorsal on the other side. So this pulse is also normal, is very strong and has normal rhythm, so I'd give that one a +4, and then we'll just do the dorsal pedal pulse here. This pulse is also normal and is very strong, and I give it a +4. So after doing my assessments, I would put everything that I did and everything that I assessed and found into the patient's records.